We were founded in 2000 by a couple of preeclampsia survivors and a physician who realized that there was no place to get information about preeclampsia, and hardly anybody was funding research in this area. Over 76,000 mothers and 500,000 babies die each year worldwide from this devastating condition, and unfortunately, their voices were going unheard. Since then, we've expanded our mission to focus on 4 critical areas: providing patient support and education, catalyzing research, improving healthcare practices, and raising public awareness. We're starting to see some progress in research and beginning to understand what may cause preeclampsia, but we must accelerate the development of biomarkers for screening and diagnosis, and we must find a way to prevent or treat it so that babies don't have to be born early or too small, and so that mothers' lives are not threatened. Currently, we're accelerating research through funding research grants and operating the only disease registry for preeclampsia. But until we find the cure, we must do our best with what we know today. For that, our objectives include ensuring the best healthcare practices are employed and that pregnant women and their childbirth partners are informed and empowered. Preeclampsia can strike quickly and unexpectedly, so all women need to be aware of the signs and symptoms so that they get to care and they get there promptly. At every opportunity, we collaborate with other nonprofit organizations, governmental agencies, academic and healthcare institutions, and corporations, so resources go further to increase the impact of our mission. Our medical advisory board is world-renowned and gives us an enormous amount of credibility in the field. We're incredibly grateful for broad support from partners and over 600 volunteers who give sacrificially to help us accomplish our mission. Our effectiveness is due to a small but passionate staff, partnering with an enormous network of dedicated volunteers. Doctors, midwives, nurses, researchers, those who have been affected, and people who just want to help. Over 600 volunteers are engaged in several aspects of our patient education and support programs, and we have a renowned cadre of researchers and clinicians who employ their professional skills. Our commitment to transparency, financial accountability, and good stewardship of our resources have earned us the top ratings from charity watchdog organizations. We focus on creating measurable objectives for each of our mission areas. Sometimes they're easily quantifiable, like distributing 120,000 pieces of patient education materials to pregnant women, providing over 600 hours of direct patient support, or having our website become such a rich source of information that we have 1.3 million unique visitors per year. Sometimes the metric is related to changing behavior that improves health outcomes. We collaborated on the development of clinical management guidelines that will be deployed to over 50,000 board-certified OB/GYNs in the U.S. This was especially satisfying because we introduced guidelines related to prenatal and postpartum patient education that didn't even exist before. We measure the impact of our research funding. We publish studies based on data that we collect from thousands of women affected by preeclampsia. We face the challenge of being focused on a set of medical conditions that are not commonly understood, often misdiagnosed, or maybe dismissed as normal pregnancy symptoms. And the incidence of preeclampsia is on the rise. Finally, people may assume that all we do is provide patients support, but we are much more than that. We're viewed as an influential and credible authority on these issues. We funded $500,000 in new research, which has been published in medical journals, presented at scientific meetings, and used as proof-of-concept studies for securing research support from the National Institutes of Health. We've convened a consortium of 9 companies, leading researchers and physicians, as well as the FDA, with the goal of accelerating biomarker development. This had never been done in our field before. In conjunction with major teaching hospitals, we've provided annual postgraduate training programs, and we're an active participant on the Hypertension and Pregnancy Task Force created by the American College of OB/GYNs, where we were able to get patient education added to new clinical guidelines. And we serve as technical advisors to the World Health Organization and other global maternal health initiatives. Recently, through our efforts, May has been designated as National Preeclampsia Awareness Month on the Federal Health Observances calendar. Because of this, dozens of organizations partnered with us to get the word out. This resulted in hundreds of millions of new impressions. Because the foundation was first formed as a virtual online community, we need to build programs that allow women to network locally so they don't feel isolated in their experience. Because prenatal care is usually good in this country and some women experience preeclampsia without terrible outcomes, people don't often realize just how serious this can be and why attention must be paid. We're the only patient advocacy organization working to address this fairly common disorder of pregnancy with very limited resources. Through the collective voices of thousands of patients combined with our network of expert clinicians and researchers across the country, we have identified educational and research gaps that we're uniquely positioned to fill. With additional resources, we would further develop the Biomarkers Consortium. We'd accelerate the development of the Preeclampsia Registry to be broadly inclusive, fund more research, and provide more simulation training to healthcare providers. We would also seek out additional partners, enable better mobile technology, and identify new ways to ensure patient education is provided to all expectant mothers. We realize we're missing women who have low health literacy, lack access to computers, or may need our information presented in other languages. Effectively reaching all pregnant women with information requires many more resources than we currently have. We also receive many more qualified research proposals than we're able to fund. Finally, there's a growing recognition that we're not meeting the needs of preeclampsia survivors after delivery, either through clinical care, education, or helping them address the long-term impact on their health.